So we had a really good discussion about that in the Meet the Expert session. So it was mainly to do with really trying to improve the care of pediatric sickle cell disease. And we actually discussed how we can improve the use of hydroxyurea in this context. And there are significant lessons to be learned from more recent research. So a very interesting study which was conducted in Africa, which we can draw a great deal of information from. It was a REACH study, which was published in New England Journal of Medicine a couple of years ago. And it clearly showed that the superiority of a maximum tolerated dose regime compared to a fixed dose regime. And it was clearly in the African context it worked very well, and that kind of led us to really push the MTD, the maximum tolerated dose regime, and uptake, increase the uptake of that MTD regime type treatment in sickle cell disease in the UK. I know that a lot of other centers in the US do that already, but I think there's a little bit of reluctance to proceed with that in Europe, and I think this study has really helped change the minds. The other thing is we discussed about how soon we can start the hydroxyurea treatment in children, and it was discussed whether 9 months, whether people are doing it at 9 months or whether people were doing it a little bit older at maybe age 1 year or 18 months and so on. So it was quite a sort of rich discussion we had in that session about how to improve the access of hydroxyurea to all children with sickle cell anemia, and also to how we can reduce the kind of skepticism that it might be prevalent both amongst doctors, nurses, as well as among parents. So that was quite an interesting talk. The other thing which I thought was very rich, the discussion that came out of that session, was how we really should try and improve or raise the bar of treatment that we have. At the moment it's mortality that we are kind of looking at, and how we kind of tend to be really happy that children are no longer dying in childhood in the Western countries. But I think we should concentrate not just on mortality, but quality of life and preservation of organ function. So I think in that sense, hydroxyurea is a very valuable tool to do. So that's kind of mainly the thing, and I have had people come back to me to say they've really that message to start hydroxyurea really early and aim for maximum tolerated dose has hit home really well, and that will have changed their practice going back to their clinics.